Hi, everyone. Welcome to the Black and Neuro seminar series. We'll just give it a second for people to come into the webinar, and then we'll get started. And just so everyone's aware, there's a live closed captioning that's available. You just have to go down to the bottom of the screen, and you can click the live transcript option, and you can get live captioning. So we'll just wait 1 or 2 more minutes, and then we'll get started, everyone. So hi, everyone. My name is Ashley Cunningham, and I'm a second year now PhD student at the Icahn School of Medicine at Mount Sinai, and welcome to another Black and Neuro seminar series. So today we are excited to introduce Dr. Sarah Dwight, who will be giving a talk on being a catalyst of change and talking a little bit about her experiences as a Black neurologist. And so just to give a little background on Dr. DeWitt, Dr. DeWitt is a board certified neurologist, educator, and mentor dedicated to quality care, promoting diversity, and addressing health disparities. She completed her Neurophysiology fellowship at the Mayo Clinic, Arizona, where she also served as assistant professor of neurology at the Mayo Medical School. Prior to earning her doctorate of medicine from the University of Kansas, Dr. DeWitt graduated from Scripps College with a BA in molecular biology. And after medical school, she became the first Black woman graduate of the Neurology Residency program and Neurology fellowship programs at the Mayo Clinic in Arizona, where she served as the educational chief resident, wellness ambassador, social media director, and education physician liaison for student interest group in neurology. During her fellowship, she also co-founded the Mayo Clinic Diversity Mentorship Program, which matches medical students with residents, fellows, or faculty members based on mutual matched dimensions of diversity. She also co-founded the group Melanin at Mayo in Arizona, which promotes community mentorship and networking opportunities for Black trainees. She's also co-authored over a dozen neurology publications in various peer-reviewed journals, including Neurology and the Mayo Clinic Proceedings, Quality, Innovations, and Outcomes. So we're pleased to welcome Dr. DeWitt.
Welcome, everyone, and I appreciate your kind introduction. I'd like to thank the organizers and leaders of Black and Neuro for the honor and invitation to share my journey in neurology. And thank you for attending my talk on leading quality-centered innovations in healthcare and medical education. And so the learning objectives will be to identify gaps in medical education, review gaps in inpatient clinical practice, discuss effective systems-based quality improvement strategies while applying process improvement principles. And before I get started, I'd like to first share a parable, and that's the parable of the blind men. So the parable of the blind men and elephant highlights this important topic of blind spots. Blind spots are prevalent, and people can be unaware of their blind spots. And a group of visually impaired blind men and women heard that a strange animal came to town, but none of them were aware of its shape or form. And out of curiosity, they said, "We must inspect it and know it by touch, of which we can do." So they sought it out, and when they found it, they touched it. The first person landed on the trunk and said, "Oh, this has to be a snake." The next person touched the ear and called it a fan. And for the next person, they touched the leg and referred to it as a tree. There was a blind woman who placed her hand upon the side of the elephant and called it a wall. The last person touched the tail and said, "It's a rope." And while another actually felt its tusk, stating, "It's hard and smooth like a spear." And so if you're the victim of a blind spot that you truly believe in, as evidence comes in against you, you are much more likely to double down. And this is actually the moment where instead of doubting and saying, "Wow, I was wrong," you say, "No, I'm so right." And it's a psychological principle and process that's born out of cognitive dissonance, which means that your perception of the world and the evidence are no longer matching. People hold out until they can't anymore. And this is essentially the core of any social change movement. For instance, the civil rights movement, Black in Neuro, and a number of other movements. And I believe this parable and the cognitive dissonance that occurs is connected, especially with matters on inclusion and diversity. And so I think of this story often, especially while reflecting on my medical journey, having led quality-centered innovations in healthcare and medical education, my two passions. And diversity of thought is essential in identifying and addressing blind spots and gaps to solving problems. And most importantly, meeting the needs of our patients. And physicians are supposed to be trustworthy and credible and seek the truth. Physicians are in a unique position of power and should always strive to improve beyond the status quo, particularly in today's climate with the COVID global pandemic and America's racial awakening. And healthcare needs to be better than the current status quo. In the parable, the people on the team were of a homogenous group. They were all blind and wanted to solve the problem the same way, through touch. And bringing others to the table helps in identifying blind spots. And similarly, this applies with patient care, which is why diversity of thought and teamwork are essential and mission critical to delivering high quality patient-centered care. And so what are the blind spots in medicine? And about 10 years ago, I applied to medical school because of my interest in social determinants of health, these factors on this image here. I became a physician to promote the social environments that promote attaining the full potential for health and well-being for all. And because of my lived experiences, I am most passionate about access to quality education and healthcare. So now I would like to dive into discussing these 4 initiatives that I mentioned earlier, which I led over the course of my residency and fellowship training at the Mayo Clinic in Arizona. For those less familiar with quality improvement, the principles are very similar to those of morbidity and mortality conference, where one person is encouraged to review cases with a diligent mind for patient safety. It's a really kind of team-based approach. And DMAIC, which stands for Define, Measure, Analyze, Improve, and Control, is a standard framework for quality improvement initiatives used to really improve any existing process. So with this framework in mind, I'll discuss key findings of these 4 quality-centered initiatives. So the first is looking at our interdisciplinary intervention to improving systemic thrombolysis in our acute inpatient stroke patients. And a little background, so stroke is the 5th leading cause of death in the United States, and approximately 800,000 strokes occur per year in the US, and 87% of these are acute ischemic stroke. Reports can estimate up to 17% of total strokes occur in patients already admitted to the hospital for other health issues. And so patients who develop a stroke in the hospital setting have consistently worse outcomes than those who develop a stroke outside of the hospital and present to the emergency department. Having a stroke on an inpatient floor has been identified as an independent risk factor for higher mortality and worse functional status on discharge. And I find these results counterintuitive. They may seem counterintuitive because the patients in the hospital, it has the ease of access to healthcare providers in a hospital ward should decrease time lost to transporting, recognizing, and treating stroke patients. And so the primary aim for this project was twofold: to identify and address the barriers to inpatient TPA administration, and by implementing an interdisciplinary program to reduce those times. And so the primary outcome was a reduction in the stroke alert to needle time to meet the national guideline recommendations, which is a benchmark of less than or equal to 60 minutes. And so with this, we learned quite a bit. There were two-pronged interdisciplinary intervention approach. So the first was to provide education of first-line responders, which was most commonly going to be the neurology resident trainees. And the second approach was really making it more accessible across the hospital. So strategic stocking of alteplase in automated medication dispensing cabinets across multiple nursing floors. And at the 2-year post-intervention mark, our mean time from stroke alert to thrombolysis had reduced by 20 minutes. And so it was 77.8 minutes when we first had measured, and then in 2 years through consecutive annual boot camp training had reduced our times to 57.8 minutes. This also translated to improved knowledge scores for our trainees across the American Heart Association and ASA guidelines and alteplase administration, as you can see there, for consecutive years. And resident satisfaction and confidence also improved. So 78% of our participants marked the top box of very satisfied, and confidence increased by 2.2 levels on a 5-point Likert scale. And so what happened and our lessons learned and the sustainability with this project. So our intervention strategy was an interdisciplinary effort designed by multiple stakeholders, including a vascular neurologist, a stroke center coordinator, nurse administrative specialist, stroke pharmacist, senior neurology resident, and medical students. Especially vulnerable and worse outcomes compared to their outpatient peers. And so in the inpatient setting, the time from decision to treat to treatment delivery can be shortened by resident education, hands-on simulation, and increased availability of alteplase within the hospital. And this subsequently reduced the overall time of perfusion of brain ischemia to improve patient outcomes. And so our impact, fortunately, we were able to make a lasting impact with this project continuing even in the virtual setting and this consecutive year, and have received recognition by the Mayo Clinic School of Graduate Medical Education, our Quality Academy, as well as publication for those interested in learning more in the December 2020 Mayo Clinic Proceedings publication. And so the next project I'd like to discuss is enhancing the Mayo Clinic Arizona Neurology Residency education experience. So the Accreditation Council for Graduate Medical Education, the ACGME, developed the Neurology Milestone Project with a focus on systems thinking, practice-based learning, and improvement, use of information technology to optimize learning, knowledge and adherence to ethical principles, as well as neurologic subspecialty categories, management and treatment, and more. The primary goal for this was to identify educational gaps and implement innovative collaborative educational interventions to improve the experience among our trainees. And so between 2018 and 2021, optional questionnaires were administered to our neurology residents before and after a two-pronged educational intervention. So the first was the development of the survival guide handbook, and then the redesign of the academic half-day experience. And so identifying the blind spots was a group effort, and with the support of our residency program director, and myself in my role as an education chief resident, led the education quality improvement initiatives, and we collaborated with our internal chief resident on the health technology initiatives. So a gap analysis was performed and showed curriculum content delivery, career navigation, flexible access of education resources, as well as wellness for primary areas for improvement. And as such, an 85-page survival guide handbook was created to address inpatient general neurology outpatient neurology, night float, and inpatient stroke neurology topics. And as such, the survival guide questionnaires actually obtained 55% response rate on multiple years. And Dr. Bleckett actually helped with implementing this into a online application. And so you see here on this is our table of contents for the survival guide that we were able to give to our trainees and onboarding of medical students when they start their neurology rotation. And so the comparison between pre and post-education interventional showed significant improvement among numerous metrics. So trainee comfort when evaluating a new general neurology consult in the emergency department, morning patient pre-rounding, outpatient workflow, and acute inpatient stroke alert workflow. And so as an education chief resident, these were the interventional strategies utilized. So 6-prong, first, ongoing use of the high yield survival guide and the online application for convenient electronic access, increasing access to additional neurology academic resources, having expert panels to discuss the scope of neurology practice opportunities, curating positive content and wellness books, centralizing our educational materials and scheduling, which was a large opportunity for improvement, as well as really the reform and modernization of the educational curriculum, with emphasis on pre-reading, quizzes, focused block structure, and increased in-service exam content year-round. And this was very exciting. So our questionnaires for the academic half-day obtained 100% survey response rate between 2018 and 2020. And as you can see here, the comprehensive academic half-day reform led to positive outcomes. Comparison between pre and post-education showed significant improvement in neurology resident physician satisfaction across multiple neurologic subspecialties as outlined here. And the clinical neurophysiology subcategory was continued upon in my role as a fellow, which for time I won't be able to go into, but through monthly EEG and epilepsy lectures. And so this was exciting and we learned a lot. This project stressed the importance of trainee-led and patient-centered educational innovations to improve longitudinal outcomes of resident educational experience and satisfaction. This was accomplished via innovative technology and thoughtful structured educational content and delivery, which continues to occur in the current virtual learning setting. And we were also recognized at the recent 2021 Mayo Clinic Quality Conference as a top poster. And so with the 2 interventions left that I'd like to discuss, I'm going to now characterize the development of the Mayo Clinic Diversity Mentorship Program. So this was a very rewarding, effective trainee-centered diversity initiative. This highly inclusive program would not be possible without the dedication and teamwork and collaboration of so many people. But you might be wondering, well, why is diversity important in medicine? And it's mission critical because of patient care. And diverse teams are able to solve problems faster. They're more effective. And diversity starts at the beginning with access to opportunity and a sense of inclusion and belonging, with mentorship. And effective mentorship and guidance and sponsorship is essential for achieving academic success, career advancement, and social networking. And representation is important, and trainees recognize that mentorship and sponsorship have a positive effect on their well-being. So this was a very natural transition for me to continue mentoring medical students and help develop a sustainable program with the goals of promoting diversity in medicine. And so our purpose with this program is really to develop a meaningful social support system for individuals with shared life experiences. And the program promotes mentorship, profession advising, social connections, recruitment into our graduate medical education programs, retention, and workplace diversity. An opt-in survey was sent to the Residents and Fellow Association electronic mail listserv and to all the medical students. And so all of the Mayo Clinic, Arizona School of Medicine students were eligible to receive a diversity mentor based on mutually matched dimensions of diversity. 28 mentee-mentor matches were established between medical students, residents, fellows, and faculty. We had a robust response locally with nearly 40 residents and fellows signing up to be a mentor. And additionally, for the 3rd and 4th year medical students, they were matched with a profession-specific faculty member. So pledges were sent to medical students, residents, and fellow participants. And this pilot program serves as a framework for the enterprise-wide Mayo Clinic Diversity Mentorship Program at Rochester, Minnesota, and Jacksonville, Florida. And participants were sent these comprehensive satisfaction surveys after 3 months. And so as you can see here on this graph, all of the Mayo Clinic Alex School of Medicine students were eligible to receive a diversity mentor. There are various metrics, for example, race and ethnicity, sexual orientation, gender identity, expression, ability, spirituality, faith, international, rural, first generation, and college, veteran status, and other. And the day after MLK Junior Day on January 19th of this year, the program went live. We had a 2-hour virtual welcome event with 41 participants, and participants networked with their designated mentors and other trainees. A resident and fellow Q&A panel provided medical students opportunity to ask anonymous questions ranging from life advice to navigating medical school and the culture of medicine. And this was exciting. The surveys that we performed showed a very exciting response at 3 months. So the following areas, the means are represented there on various metrics from resident, fellow mentor experience, the satisfaction with communication from the leadership, as well as overall support system, and the welcome event. Additionally, participants provided optional comments and feedback highlighting the relational benefit of a mutually matched mentor with similar shared life, lived experience. And I found the most powerful statement in this one participant's response. They said, "It was inspiring to listen to various physicians give their testimonies on their life journey and how it led them to medicine. I believe physician testimonials should be included in future events because it helps students meet physicians who are outside of their immediate circle. That way we can continue to expand our network and community at Mayo." And so this was very exciting, kind of trainee led and run, wouldn't be possible without the dedication of so many. And with that, I'd like to discuss the 4th intervention, which was establishing the Melanin at Mayo, Arizona group. And fostering diversity and inclusion in the US physician workforce is a recommended strategy to address healthcare disparities. And underrepresented in medicine people include Latinx, Black Americans, American Indians, and Pacific Islanders, which continue to be drastically underrepresented in medical education and health professions. And so mentorship is a critical element in addressing equity, career advancement, social networking for individuals, especially individuals with diverse experiences. And recently, with the Association of American Medical Colleges stating the ongoing pandemics, both COVID-19 and racism, have laid bare the dehumanizing and damaging effects of structural racism throughout our country. In the past year, the academic healthcare community has sent out multiple statements denouncing systemic racism in the United States and outcries to dismantle it. As such, in our response to their call of action, we'd established Melanin at Mayo, Arizona, an informal affinity work group. And numerous studies have shown the benefits of consistent and culturally sensitive support for students underrepresented in medicine. So consequently, we developed MAMAs, which we name, to provide this mentorship, professional development opportunities, and real social connection for Black medical students, residents, fellows, and recent alumni. So I'll be characterizing the development of the program and discuss the professional, emotional, and social impacts of this affinity group. This initiative aims to address structural racism and its impact on medicine by reducing the isolation and providing a flexible environment for trainees of African descent to succeed socially and professionally. And so to talk about kind of the current status of healthcare, when we talk about underrepresented medicine, according to the AAMC, their definition is meaning those of racial and ethnic populations that are underrepresented in the medical profession relative to their numbers in the general population. And so this graph here is taken from the 2019 census data, where we're going to be looking at whites in this navy blue and then Blacks in this lighter blue. And so you can see the relative trend. And so in the US population, there's about 75% of people who are white, and those who subsequently apply into medical school, about 45%. And the trend is a pretty upward trajectory when we look at those who are accepted to medical school and subsequently matriculate and graduate and then become active physicians. And then of those who are become faculty, greater than 60%. And then specifically in neurology, also kind of a matching parallel. And the line looks very different among Black Americans. And so to highlight this, I think looking at this trend on a different page will be helpful. And so with relation to the US population, Black Americans comprise about 13%. And when we look at medical school applicants, 8% were Black. Of those accepted, another percentage point kind of drops. And those that matriculate and subsequently graduate, we see another percentage drop. And about 5.6% become active physicians, and even less so become faculty. And then specifically in neurology, at least in 2018, it was about 1.8%. And so that's a very kind of different linear trajectory. This is where I sit. And so why is this important? It's important because of our patients, because Black Americans have a higher prevalence of stroke. They have the highest death rate from stroke than any other racial group. African Americans are 50% more likely to have stroke as compared to white counterparts. Black men are 70% more likely to die from a stroke as compared to non-Hispanic whites. And African American women are twice as likely to have a stroke as compared to non-Hispanic white women. Stroke mortality in the US has consistently been greater among Blacks compared to whites. And then even with other subspecialties, for instance, headache, compared to their white counterparts, African American patients with headache are more likely to be diagnosed with comorbid depressive disorders, report headaches that are more frequent and severe in nature, have their headaches underdiagnosed and or undertreated, and discontinue treatment prematurely regardless of socioeconomic status. For example, even in multiple sclerosis, African Americans and Hispanic Americans have higher incidence compared to their ancestral countries of origin and are represented in clinical trials in the United States. In Parkinson's disease, race matters too. There's a clear racial disparities in treatment and mortality, and African Americans are less likely to be diagnosed with Parkinson's and are more likely to have delays to diagnosis, and once diagnosed are undertreated when compared to white patients. And so this translates to worse outcomes, including higher mortality, and the needs of our patients come first. The goal of these two programs was really to address this gap, what may be referred to as the leaky pathway. And so these two programs do that by trying to cultivate a culture where trainees feel fully valued and supported on their journey and address the recruitment and retention gap. And, I was wondering what exactly does, 1.5% translate in neurology, and relative. So I was curious and I looked up the AAMC available data. And in 2018, there's 158 Black female neurologists compared to about 2,600 white female neurologists. And then there was 191 Black male neurologists compared to about 5,600 white male neurologists. So just highlighting the gap here. And so prior to joining MAMAs, the attendee participants rarely really interacted with one another due to multifactorial issues, including multiple campus sites, rigorous work schedules, the pandemic. And so a modified 12-question diversity engagement survey was administered. And so questions assessed the behaviors that described an inclusive environment with the following inclusion factors: appreciation of individual attributes, access to opportunity, cultural competency, equitable reward and recognition, respect, and trust. And descriptive analysis and statistics were used to summarize differences between the last 12 months and 30 days after joining MAMAs. And the survey response rate was 100%, an N of 19, as you can see the gender ratios there. And 55% of respondents identified as first-generation college graduates. And so the differences, which I'll discuss in the next few slides. And as a frame of reference, the Mayo Clinic Graduate School of Medical Education in Arizona trains approximately 230 residents and fellows each year, while the medical school trains about 205 medical students. So 19 of our trainees of the 21 opted into, self-opted into MAMAs and in informal affinity group with the goals of promoting an authentic social networking experience and friendship for trainees with similar lived experiences. And so when looking at our results, the primary goals for joining the group were actually to help others succeed and make others' paths easier. And we know that, multiple studies have shown that Blacks experience more social isolation compared to white colleagues and are more likely to experience microaggressions and biases. As a result, they seek support from other Black students and physicians. And so you can see here that Dr. Tatum actually discussed, as a Black woman, I was told not to pursue a career in medicine, and the path must be easier for others. And this was a recent publication in the Washington Post. And the story continues with numerous individuals. So Dr. Harp, who's actually a neurologist as well, and currently doing her fellowship at Harvard, wrote a nice piece in May about why I will not be attending my medical residency graduation, highlights her experience. Dr. Landry, also out of Harvard, wrote a piece in Vogue about one ER doctor reflects on a career of being the only Black person in the room. And so this is a common experience, and many of the leaders of Black and Neuro who have published really prolifically on this topic and this experience, which I highly recommend you check out. And so there are other metrics that people joined. So to seek an informal mentor, to celebrate achievements, to learn how to navigate the hidden curriculum of medicine. And so the survey was performed after 30 days of joining the affinity group, and our outcomes were positive in these three metrics. So appreciation of individual attributes, cultural competence, and equitable reward and recognition. And this was really exciting. So some of the questions that were on the survey, as you can see from the external validated diversity engagement survey, I'm confident that my accomplishments are recognized similar to others who have achieved their goals. And we see a positive upward trajectory from many of our participants after joining the group. And similarly, someone at work or school seems to care about me as an individual. And so very few programs have actually addressed the social aspects of improving the URIM experience. And in our study, we found that 30 days in the informal affinity group, trainees noted an increased appreciation of individual attributes, cultural competence, and equitable reward and recognition. And so with the paucity of research on initiatives that provide social support specific for URM trainees, there leaves room for creative and simple interventions to increase the well-being of Black medical trainees. And so our results reinforce the need for a supportive niche among colleagues to be able to achieve the goal of a sustainable, diverse workforce. This program speaks to how those that participated in MAMAs allowed for isolated individuals have the ability to find a sense of belonging, community, and feel valued, for fostering a sense of belonging and hopefully translating to ongoing recruitment and retention in the future. And this work was selected as a semifinalist for the 2021 National NMA annual meeting, which was exciting. Of note, the results that didn't show any improvement were systemic factors such as access to opportunity, respect, and trust. And so two explicit kind of ways that institutions can support this experience is by two manners, really a direct and indirect approach. So direct meaning hiring more diverse faculty, recruiting more diverse trainees, discussions and programs targeted towards the general body led by URMs, and indirect by supporting activities curated and targeted for URMs. And so I'm grateful for the opportunity to be the first Black female and second Black graduate in both my neurology residency and fellowship programs in Arizona. And prior to me, Dr. Spencer was recruited in 2004. And patients come from diverse backgrounds, and given that the needs of our patients come first, inclusive initiatives will help identify and address blind spots and gaps with the goal of enhancing medical education and clinical practice for all trainees. I'm so proud to be part of the diversity mentorship program and Melanin at Mayo, Arizona, which serve as vehicles to promote diversity of thought and improve upon existing recruitment and retention efforts of future diverse talent. And in closing, diversity of thought is essential in identifying and addressing blind spots and gaps to solve problems. and most importantly, is critical to meet the needs of our patients. Becoming a physician, in particular a neurologist, has fueled my sense of agency, understanding the devastating, unforeseen, acute or chronic neurologic conditions, such as hemorrhages and cardiac arrest and brain death and ALS, brain tumors and traumatic brain injury. And I believe the beauty of diversity is that everyone has varied interests. So let's invite more people with very diverse lived experiences to the table to help identify blind spots, question the status quo, and take action in improving access and quality in healthcare and education. And quality improvement amplifies research the same way activism amplifies advocacy. A mentor once shared with me that quality is love. So while we are here, we should make a point to love intentionally, with accountability and with a sense of urgency. And references are available on the recording of this presentation. There are so many people to thank as well, and acknowledging all the amazing members of our patient-centered quality stroke team. Those who helped with improving the Mayo Clinic Arizona Neurology Residency educational experience. And my colleagues who helped in developing the Melanin at Mayo and Arizona affinity group. And this work would not be possible for the Mayo Clinic Diversity Mentorship Program without all these people. And for time, I didn't get to talk about other quality initiatives, but clinical neurophysiology, EEG, epilepsy monthly lectures, and fellowship research in clinical neurophysiology and epilepsy, as well as our wellness initiatives. So many people to thank. And I want to thank all of you for your time and attention. Are there any questions at this time?
Thank you so much, Dr. DeWitt, for your amazing talk. We do have a few questions. I'll actually start with one that I had. I thought that the programs that you and your colleagues developed were super interesting, and I was wondering if you plan on trying to expand those to other institutions or other like trainee programs.
Which program?
The MAMA was interesting. Also how you improved just the training aspect to better equip trainees with dealing with like stroke patients.
Yeah, thank you so much for that question. So, shout out to Dr. Nicole Joseph, who helped, who started the Melanin at Mayo in Rochester, Minnesota in 2017. And that was kind of what inspired us to start the chapter, and along with all the changes that have been happening in the last year in Arizona. And so they've now started, I believe, in Jacksonville, Florida. So that's now spreading. And with respect to the stroke initiatives, that's why we also shared our knowledge and our findings with the greater community, so that learning there are simple and essentially free ways to improve processes, especially with acute inpatient strokes, which, paradoxically, you'd think the times to treatment would be shorter, but this is a national issue. And so hopefully other institutions will be able to learn from our experience and even from an enterprise level.
Great, thank you so much. So we have a couple of questions in the chat. I'll go ahead and read them to the group. So we have a question from Hannah, who's asking, do you have any advice for aspiring neurologists? What are some useful resources or other things to keep in mind? And thank you so much.
Yeah, thank you. I am a big fan of the AAN Society. So I received a diversity scholarship to attend the annual meeting when I was a medical student, and kind of got involved with SNM, the Student National Medical Association. So those, I think, are really good organizations to learn about and have strong opportunities to find mentors and get inspired. And I think my interest in neurology became more specific really after those experiences. Also, if, for example, in undergraduate, my interest was really peaked in the neurosciences through research in the wet lab, like many of you. So I highly, recommend working with somebody that inspires you, and that'll only just strengthen your journey.
Thank you. We have another question from an anonymous attendee who's asking, do you have any tips for battling imposter syndrome? How do you motivate yourself at times when you felt isolated in your work/schooling?
Yeah, I think, so that article that Dr. Landry, writes is I think an important article in thinking about what is imposter syndrome and how is it, defined. And so I think the more people that have diverse experiences, I think there's a perspective and a reframe of what that means. And so it's not uncommon for me to be kind of like the only person who looks like myself, but there are a lot of people and mentors and sponsors that you can find who have shared experiences, so to speak, or are motivating. So I wouldn't let these perceptions of imposter syndrome kind of get you down, and just kind of, I think it also decreases with time the more you're doing something. So perhaps on the initial trial of, for example, even doing a wet lab experiment, right? So there might be some failures, but kind of troubleshooting and getting to the best results. So just kind of persisting. So that's a great question, but check out that article.
I really love that answer because I constantly struggle with imposter syndrome. So it's good to know that it does get better, and to just like keep at it.
Just show up.
I do show up. So there's that. Here's another question. Let's see. Do you know of anyone who has not pursued medicine with a master's in neuroscience?
Yeah, I know probably the majority of people I know did not have a master's in neuroscience. I was super excited after my initial experiences in research in neuroscience, molecular kind of biology. That's what I studied in undergrad. And so that, I was deciding whether I should be like a physician scientist, MD, PhD actually, and took some time to do research, and then decided kind of the best fit for me would be to pursue medicine and then do research in that capacity, because you can still do that, as an MD. And fortunately, hopefully I've highlighted some of the ways I've done that. And so if you are interested in neuroscience, go for the master's or PhD if you'd like, but there are ways to do research as a physician too. And majority of people I know don't have a master's in neuroscience.
Thank you so much. There are also a couple of questions about finding mentors in neuroscience related fields. Specifically, if you were looking for specific characteristics within a mentor, such as being a female or a single parent, do you have any suggestions about how someone can go about finding mentors?
Yeah, that's a great question. So I think in general, in terms of education, which I love, there are 3 ways to learn. So you can learn through a book or online kind of content, which takes a lot of time. There are ways that you can learn through experience, which when you're initially starting off, you don't really have. You can make mistakes and learn and kind of grow from that. And then the third way I really feel like people can learn are through other people, through finding these mentors. And so it takes kind of, I think, a lot of like trial and error, because there are a lot of types of mentors that you can have. And actually, I've started a thread on my Twitter if you are interested, with people who have just self-volunteered and identified for wanting to be volunteer mentors for people applying into neurology and psychiatry, actually. So all those people who have, again, volunteered and have been matched, especially if you're applying into those medical specialties. And then, Black in Neuro has excellent threads. There are a lot of societies that can match you with a mentor. And I think it'll be just brilliant someday if somebody develops an app, like a mentorship app, and you can just match in, like perhaps, kind of like this process in being able to pair our medical students with faculty or resident and fellow. It was so helpful that the medical students would write comments in the other and exactly what they were looking for. And so whether that's, race, ethnicity, being a parent, being of a, based on your gender identity, or part of the military or something like that, I think it would be brilliant if somebody just develops a free app to be able to help people. And, sometimes you think you're interested in a specialty or a field, but then you get in there and you're like, well, maybe that's not the right fit. So, but check out at least those professional organizations. And again, the threads that are available on social media, on Twitter.
An app would be so amazing. It'd be like Bumble Friends, but like for mentors. That would be great.
We should send that to Bumble.
Yeah, we'll get right on that. I actually think we could maybe like partner with them and get something going. So we have another question. Could you expand on the two goals of Melanin at Mayo as to addressing the recruitment and retention gap?
Oh, I'm sorry, can you repeat the question?
Oh yeah, I'm so sorry. So the question was, can you expand on the two goals of the Melanin at Mayo as it addresses the recruitment and retention gap? So I guess like how does this group plan on addressing these two things?
So as I highlighted and showed our AMC data of what the current status is for Black medical students entering kind of the field and those that end up practicing. And so, which is a very kind of different trajectory. It's a very similar trajectory to other URM groups, but different from our white counterparts. And so this was kind of the ideal to be able to provide a social networking system and authentic kind of relational experience for Black trainees in particular, to be able to know each other. And we have like these monthly meetings where people can even discuss various topics. So elements of that people could talk about racism in medicine or microaggressions and kind of get advice. And so I think by reducing that isolation piece, it hopefully will translate to those metrics. But we don't have enough data obviously yet, but I think with time and as this kind of data is captured and measured, which I'm a big fan of, capturing and measuring data, if you can't tell, that hopefully that will increase in the workplace diversity.
That's great. And I think I agree. I think capturing the data and measuring is a good way to show that like what you're doing is working, and a great way to like quickly make adjustments if needed. So we have another question in the chat by an anonymous attendee, which is asking, what should institutions do to value diversity initiatives and underrepresented minority work? And consider this when it comes to promotion and tenure.
Yeah, that's a great question. So there was a recent post that I actually saw that Dr. Silver on Twitter, on social media, had actually outlined that I believe Harvard has made this types of initiatives and efforts in diversity, equity, inclusion as a metric for promotion. So I think that's a huge step and makes faculty feel valued who are doing this work, and oftentimes they're doing this on top of other tasks and obligations. So following a similar model like that, I'm sure that'll happen in the next few years, that other institutions will adopt that, along with education service and other metrics for promotion and publication and research. So I think that's a good model. And then was there a first part in terms of the actual trainees as well? To that question, how can we support trainees, I think?
Yeah, so the first part of the question was asking what should institutions do to value the work that is being done? And so I think you answered that with like in regard to promotion and tenure.
Okay, perfect. And then, I know they didn't ask, but that's what the faculty and obviously with the trainees, I think fostering these types of trainee-led experiences or having direct and indirect manners of sponsoring URM trainees.
That's great. So we have another question in the chat. which is asking, which first they say, excellent presentation and thank you. What role can groups like Black Healer Network and Forever Wakanda play in increasing diversity in neurology and neuroscience?
Yeah, those groups are tremendous. I have to say, being a part in recognizing all the change that they're affecting and catalyzing, really, including Black in Neuro and the Black Healers Network, because I think representation is important, and the visibility that these groups present, and also the power of the collective voices and the advocacy that they're doing is just remarkable and inspiring, and has inspired me too over the last year. So I'd like to thank all those organizations.
Thank you so much. And we have another question in the chat, which is, have you ever had a fear of public speaking? And do you have any tips for overcoming it?
Public speaking, I think I talk a lot, and this virtual setting has made that kind of maybe easier. But yeah, probably just practicing is important for any skill. So the more you just talk to your friends and talk to other people, hopefully that'll be easier.
Thank you. And then we have another question in the chat by an anonymous attendee. When did you discover that you had a passion and talent in medicine?
That is a great question. So I first had my interest actually pretty early on, like in the 2nd or 3rd grade, when we were learning actually about like anatomy and the bones. So I asked my father, who retrospectively like is such a feminist, for a book, like anatomy book, and he got that for me. And then I got like this video microscope thing that I could like peel onion skin layers and look at them in the microscope. So my interest and like love of like science and medicine kind of started, for me at least, early, and was able to foster that through various like important mentors along the journey in university, in medical school, and then as a trainee in residency and fellowship. And so, yeah, it's a little corny. I know I was like really young when when it started, but that's the truth.
No, that's so great. I feel like everyone's like finds their passion for science and medicine at different stages. And I love hearing that some people like found it very early. And so we have another question in the chat by someone, D. Gary, who is currently in the application process for medical school, and is just wondering what they can do career-wise while they're studying to take the MCAT. So if you have any tips on like that career path, that would be amazing.
Yeah, so I think being able to do any kind of experience. So I told you kind of the 3 ways, at least my philosophy of learning. So I've been able to learn a lot through various experiences, and even these, 4 initiatives during my 4 years of training. So whatever might be that excites you. So finding out what excites you and you're passionate about is great, but also figuring out what you don't like is also super important. So there isn't really any wasted time as you're applying and doing all the MCAT prep. So whether that's, again, working in a neuroscience, like in a wet lab, if it's doing, clinical trials or research, if it's even being like a lifeguard, during really anything, or fitness or wellness, because I think whatever you do will translate into medicine. And a good friend of mine was like a religious scholar, actually didn't have any experience in pre-meds and all those kinds of things before going into medicine, but I think that helps inform him for his patients and how it helps him connect on a different level. So I think I would just like stress, do whatever that excites you and you're passionate about, and hopefully you'll find your niche, because the great thing I believe about medicine is there's a space for everyone. And whether that's working with patients directly as a clinician, or you can be like a physician's physician, like our pathology colleagues will give us consultations, or radiologists, we can consult them for their advice on imaging. So there's really, a lot of space and inclusion in medicine. So figuring out what you do and don't like.
Thank you. It sounds like there's lots of paths to get there. Just have to pick the one that's like best fit for you.
Absolutely. And so anyone who tries to tell you that you cannot be a physician, is probably not helpful because there's many ways to become a physician, and I think, I've been told that several times, early and throughout my career. So just keep going and do what excites you, and you'll find your passion along the way.
Thank you so much. And so we have another question from an anonymous attendee that's asking about a different stage in the neurology neuroscientist career path. It's someone who is a IMG who's currently studying for the USMLE, and they're wondering what activities or programs you suggest for someone aspiring to be a neurologist/neuroscientist in the near future.
Yeah. So I think it's kind of related to the other question too, about the person who's in a slightly earlier stage in the MCAT kind of process, and really pursuing things that interest you and excite you. So, as I mentioned, I was interested in becoming a physician scientist through the traditional kind of PhD program. And so I spent some time at the CDC and the kind of environmental health factors, developing nutritional bioassays. So that doesn't sound like exactly, as it translates, but then I learned about, ferritin and all these molecules and labs that I actually order today. And now I know how these tests are done. So it makes me very, cost conscientious of these protocols. Also, I learned about the environmental health factors that are related to my patients. And had I not done that experience, I don't think I would have that appreciation and depth for those important matters. And so I think a lot of things are, interdisciplinary. There isn't a cookie cutter approach to, I have to spend, several hundreds of hours in a neurology shadowing opportunity, which I highly recommend, of course, shadowing and seeing if neurology is the field for you. But really, again, just follow what interests you. And I think you'll find what excites you. It might take time, but hopefully you'll find it sooner or later, or enjoy the journey on the way.
Thank you so much, Dr. DeWitt. So we're actually out of time, and you've answered all of the questions that came through the chat. And we just want to thank everyone so much for being here, especially Dr. DeWitt, for sharing a bit about your journey to becoming a neurologist, and some of the really cool implementations that you put in at your hospital. So thank you so much. All of the recording will be available on our YouTube, so please go check that out if you came in a little bit late and want to hear Dr. DeWitt's talk. And so hopefully we'll see you all at the next Black and Neuro Seminar Series.
Thank you, everyone.
Great job. Thank you so much. It was so wonderful.